Hello everyone, I am Dr. Ameen Shams. I am anesthesiologist at Cura hospital. Today I would talk a little about anesthesia. There are a lot of misconceptions and myths surrounding this branch of medicine. So many times I have seen that the patient is not actually scared about the surgery, but they are very scared of anesthesia. So first and foremost, let me tell you there are three types of anesthesia that we usually use: general anesthesia, regional, and monitored anesthesia care. Coming to general anesthesia, if the surgery is being performed on the upper part of the body, like say the head and neck surgeries, brain surgeries, on the thorax, or any laparoscopic or keyhole surgeries on the abdomen, we use this general anesthesia. In this, we put the patient to deep sleep where he is not aware what is happening to him. He'll be completely unconscious. Most of the drugs that we use in general anesthesia are short timed. So once the procedure is getting over, we can reduce the dosage of the drugs and we can wake up the patient as soon as the surgery is over. But for the patient to completely come to his senses and completely awake, it may take 1 to 2 hours. So we keep the patient in recovery room. Once he is completely awake and stable, we shift into the ward. Most common side effects of general anesthesia is the patient may feel nauseous, he may vomit, and also he may have some irritation of the throat because we put a tube in his windpipe through which we give him oxygen and other drugs. And now coming to regional anesthesia, it includes spinals, it also includes nerve blocks and epidurals. Any procedure that is being done on the lower part of the body, like cesarean, open appendectomies, open gallbladder removals, or any surgery which we are doing on the lower limbs, any orthopedic surgeries, spinal anesthesia can be used. In this, we give an injection in the lower back where one drug is injected. It numbs the lower part of the body. Usually it takes few minutes for the drug to act, and the effect usually lasts for 3 to 4 hours. So any procedure can be done in a painless way. The patient will be completely awake, but if he is very anxious and if he wants to sleep, we can give him some mild sedation. And by the end of 4 hours, the patient starts feeling the sensation back and he'll be able to move his limbs. This type of anesthesia is completely safe. But there is some misconception that if you take the injection in the lower back, you get back pain, which let me tell you, it's a myth. There is no studies which prove that. Then coming to nerve blocks, this can be done on any surgery which is done on the upper limb or the lower limb, where we inject a drug right into the nerve plexus which supply that part of the body. So what happens is that area is blocked. The patient will not feel any sensation there, and any procedure can be performed successfully. Then there is something called epidural anesthesia, which is very interesting. What we do there is we put a small tube in the lower back in the epidural space which surrounds the spinal cord, and we can give any medicine continuously through this pipe. And as long as the medicine is going, that part of the area will be completely painless. This is usually used in the management of post-operative pain in some major surgeries like removal of bowel, removal of part of thorax, where the patient may experience a lot of pain later. So we can give it for the next 2-3 days after surgery so that the patient is completely painless. This is also used in labor analgesia, where in a normal delivery, epidural analgesia is given and the mother will not feel the pain of contractions of a normal labor. This is becoming very popular. People are getting aware of it, and this is completely safe, and it has helped a lot of mothers for a painless delivery. Now coming to the last type, which is called monitored anesthesia care. This is usually used in some small procedures like endoscopies, colonoscopies and ureteroscopies, where the patient is sedated, and once the procedure is over, we can wake up the patient. It is usually done for some daycare procedures. In this, we monitor the patient when he is sedated, and then once the procedure is over, we wake him up. At Cura Hospital, we have a team of qualified and well-experienced anesthetists. We are also well-equipped to perform any major surgery. We also have a great critical care team to take care post-operatively. I can assure you that your experience at Cura regarding any surgery will be very pleasant and completely pain-free.
Cura Hospitals. Healing with care.